All right, welcome back to the Elias Macko Show. A little note here. Today is Bell Let's Talk Day. And of course, with that, there's a big push for everyone to spend a moment thinking and talking about mental health. And, something that's occurred to me time and time again, whenever I'm in just a little bit of a rut, or I feel a little bit anxious, to me, the number one way, it just happened in the last week, I got out and I just went on a 30-minute walk. I got home and I was just feeling on top of the world. So in my mind, I've always thought about mental health. I often think about exercise. And there's a new study that is adding to growing evidence that physical activity can be a powerful tool in treating depression, in some cases as effective as medication. Get a load of that. Researchers found that regular exercise helped reduce symptoms in many participants, highlighting the role that lifestyle changes can play alongside traditional treatments, as mental health continues to be a major public concern. I think Bell Let's Talk Day is evidence of that. These findings are prompting experts to rethink how we support people struggling with depression and the options on the table, the treatment plans. Let's go to Dr. Nicholas Fabiano, a researcher and psychiatry resident at the University of Ottawa. Dr. Fabiano, welcome to the program.
Thank you for having me. It's great to be here.
I got to say, to me, not surprising. It's almost like I didn't need to study. I don't need to study for that. I could have told you that. So what do you say on this? What should we know about the power of exercise here in mental health?
Yeah, well, I think you've done a great summary with this recent study that brought together a lot of the randomized control trials in the area and really showed what you said, where exercise can be as effective as medications or even therapy in the treatment of depression. And beyond depression, there's evidence for exercise for anxiety and even things like schizophrenia. Obviously not as a monotherapy, but I think it really speaks to how important movement is, but also how often we overlook exercise. Because I think a lot of the times, especially from my position, we're so focused on treatment. So treatment of depression, treatment of anxiety. But another role that exercise also has is the prevention. So if we're able to get people moving on a large population level, and it doesn't need to be large amounts, like running a marathon every week sort of thing. It can be, like you said, just going for a walk every so often. These can have massive gains for the mental health of the population. So I think, yes, it's amazing to see this as a treatment, and it's something that I advocate for a lot, but also reframing it as a preventative measure for not only just mental health, but as we know, like you said, you don't need to study to know that exercise is good for you, and that extends to both mental and physical benefits.
I love where you went there, because honestly, it was going to be a question. Is this treatment or is it prevention? And I think that's just so perfect. But let's talk about, I don't know if it's a gut reaction from doctors to go along other lines, treatment, whether it comes to medication or therapy and that kind of stuff. Why do you think doctors go to that? Why is that the gut reaction more often than maybe it should be?
Yeah, I think there's a multitude of factors, but the first that come to mind is, number one, education-wise. When we go to medical school, residency, a large amount of our education, because we have so much to learn, is focused more on these traditional routes, or quote-unquote traditional. So looking at medications, therapy. So the number one thing is, a lot of physicians, whether it be your primary care doctor or psychiatrist, is probably more comfortable speaking about medications or therapy. The second part, systemically, is a lot of times it's easier to prescribe a medication, for instance. So if someone's coming into your office and you're a family doctor that only has so much time to talk to a patient, it's a lot easier to say, okay, this person has depressive symptoms or major depressive episode. I'm going to prescribe them this medication that I can write down on a piece of paper. I can type into my medical record, and that will be faxed over to the pharmacy, and this person can pick it up. It's covered. All of these systemic things are set up to allow for that to happen, versus if you're looking at exercise, you're taking someone with depression that inherently has lower energy, low motivation. These are core features of the depression itself. And you're telling them, hey, based on guidelines, I want you to exercise this many minutes a day for this many weeks doing X, Y, Z. That's really overwhelming to tell someone. And we know that the evidence also says that exercise is better done when supervised, especially with depression, to help with that initial motivation. So I, right now, as a provider, cannot write that same prescription to prescribe a trainer or someone to help supervise or get that process going. So there's a lot of barriers on an educational, but also systemic level that prevent that from happening, because the easiest route is just medications or therapy referral sort of thing. But we don't seem to use the evidence base that we have, which is hundreds and hundreds of trials at this point for exercise, for depression, and again, beyond that, even other mental disorders as well.
I find that fascinating, right? Because you can prescribe medication, but it's much harder to prescribe. Here's the running shoes I'm going to prescribe to you. And here's an app. I don't know. You're gonna use. I know there's all these running apps. Like, how incredible would it be if there was a running app that tied directly to you, and had some sort of medical aspect where you would get an update. You'd know that your patient. Oh, I just got an alert. They did a 30-minute jog today. There's nothing like that right now.
Nothing that is streamlined that we can really incorporate into practice. Because again, we can still try our best though. Because it's standard psychiatric care is if you're starting someone on a medication, you would follow up with them. You would use a symptom tracking scale sometimes to see how stuff is going. You would also adjust the dose of the medication when they're taking it, maybe. But when it's exercise, even for providers that are maybe more enthusiastic about speaking about it, sometimes it's just go for a walk, go for a run. And the thing is, the patient knows that. We need to also break down that exercise prescription into a prescription. So similar to a medication where there's dose, frequency, route, the type of medication. You wouldn't just say, go take an antidepressant. You would tell them all these parameters. We need to do the same thing for exercise and have follow-up. So without getting too much into it, you can really break down exercise into a prescription as well too, using frequency, intensity, type, and time. And you can actually write these into the patient chart and communicate with the patient too, as if it's a medication sort of thing. And I don't think that we see this a lot in practice right now. And it goes back to the lack of comfortability from a lot of providers, but also the lack of systemic support to make that happen.
Now, Dr. Fabiano, we have this growing evidence that exercise works, but do we know why it works?
Yeah, that's a great question. And I think humbly, we have to take a step back first, because even what causes depression, we don't have a one-to-one association for that. So there's a lot of different mechanisms, and I like to break it down without getting too long-winded into bio, so biological, psycho, which is the psychological, and then social, the social aspects, because we get very stuck on the biological benefits of exercise, which are important. And some of them that we see is increasing some of those neurotransmitter levels that the antidepressants also help with. So serotonin, norepinephrine, dopamine. We also know that exercise can increase something called the BDNF, or brain-derived neurotrophic factor, which in simplistic terms is essentially miracle grow for your brain. And we know that people with depression, they may have smaller brain areas and stuff due to the ongoing process itself. The other thing is exercise can reduce inflammation, so both peripherally and centrally. And centrally, I mean in the brain. And that's just some of the biological factors. But things that we overlook is psychologically, the things that we often speak about. After you get exercised or exercising, you start feeling more motivated. You start having that momentum build, and that can go to other things in life. Maybe you were able to go for a walk, and now you're like, hey, I'm going to cook a meal for myself. And these behaviors really build upon one another. And the last part that we often overlook is the social aspect. So whether you're just going to the gym, even alone, you're there with other people, you're going to a fitness class, if you're on a sports team, that is so huge to just speak to other people and have that social connection. And even if you were to remove the exercise part, we know how important social connection is for mental and physical health. That is just a huge part of that antidepressant effect. So that's just a quick whirlwind overview of some of the benefits of exercise and how it may have an effect. But it's very important that we just don't look at the biological lens, because there's so much more to it.
Listen, Dr. Fabiano, sometimes I follow, Bell Let's Talk Day, CJD is owned by Bell, so we pay a focus on it every year when it's Bell Let's Talk Day. Sometimes I find the segments can be, for lack of a better term, a downer. And I'll tell you what, this segment that we just had, I think it really reframed a lot and put a positive spin on some of this. I really, really thank you for coming on today. One of the highlights for me. Thanks so much.
Yeah, thank you so much for having me. It was a pleasure to be here.
Dr. Nicholas Fabiano is a researcher and psychiatry resident at the University of Ottawa. And a reminder that today is Bell Let's Talk Day. Join in, take a moment for mental health. Every moment matters. Whether it's caring for yourself, reaching out to others, or speaking up, you can learn more at bell.ca/Let's Talk.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This
is bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian owned and operated. Charm has been part of your love stories and bromances for over 50 years.
And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.